Hey everybody, it's Shelby, and this is Interactive Case Study 6, which we will be talking about the chemotherapy drug Oncovin. So, the description taken directly from the assignment details is that cancer treatment is often a multi-pronged approach. One of the more common treatments for cancer is through the CHOP method. CHOP is a four-drug treatment composed of cyclophosphamide, an alkylating agent which damages DNA, hydroxy denorubicin is an intercalating agent which damages DNA by inserting itself between DNA bases, Oncovin, which prevents cells from duplicating by binding to the protein tubulin, which is the one we're going to be talking about today, and prednisolone, which is a corticosteroid. Over the course of the next 2 weeks, we will examine these drugs. For today, our focus will be the prevention of duplication by Oncovin. So before we get started, we need to know what cancer is. So, in a quote taken directly from the National Cancer Institute, cancer is a disease in which some of the body's cells grow uncontrollably and spread to other parts of the body. So you can have two different types of cancers or tumors that develop. You can have benign, which are non-cancerous and usually sometimes don't grow back, or you have malignant, which are the cancerous tumors, and they can grow back. They don't always, but it's more likely that they will. Tumors. And then sometimes cell division breaks down abnormal or damaged cells and grow rapidly whenever they shouldn't. Then tumors develop, which are lumps of tissue. Tumors can remain in one place or can spread and form new tumors. It is metastasis. And then solid tumors, you can have solid tumors or tumors or just circulating throughout the blood, which is leukemia. And as you can see, here's a picture of a drawing of a normal cell and their nuclei, and then here's a cancerous cell and all of their nuclei that's very scattered and not normal. So, there are some differences, as you can see from the past photo, that they're from normal cells and cancerous cells. So, cancer cells, they grow uncontrollably, they ignore signals that tell them to stop dividing, which, whenever the signals tell them to stop dividing, it usually leads to apoptosis, but now since they ignore it, apoptosis usually doesn't happen. They invade into nearby areas and other areas in the body. They tell blood vessels to grow towards tumors, which provides oxygen and nutrients to the tumors for them to grow exponentially and continue growing. And then they hide from the immune system and trick it. And there's multiple changes to the chromosomes within the nuclei. Like sometimes there's like double the amount of nuclei, there's half the amount of chromosomes and nuclei, all of that stuff. And they rely on different kinds of nutrients, and thus they make energy differently, which allows them to survive in certain environments better than normal cells. So as you can see, there's a nice drawing here between a normal cell and a cancer cell. So as you can see, a normal cell has a large cytoplasm, which is the fluid outside the nucleus but still within the same cell. They usually have one nucleus, those big dots right there, and a single nucleosis, which are all of that, and then they have fine chromatin. And then we have the exact opposite, complete 180. We have small cytoplasm, we have multiple nuclei, we have multiple and large nuclei, and we have coarse chromatin. So, there are many different causes of cancer, and it seems like everything these days people tell you is a cause of cancer. So basically, the causes errors as cells divide during cell division. Also damage to DNA caused by harmful carcinogens. Carcinogens are substances and things that damage DNA, which thus could lead to cancer. So we have different kinds of chemicals, ultraviolet rays from the sun, we have diet, we have hormones, we have radiation. Like in my job as a vet tech, I'm required to wear a lead coat and very heavy lead gloves whenever we take x-rays of patients to limit my exposure to harmful radiation every day. We have obesity, we have chronic inflammation, etc. The list can go on and on and on. And also we have inherited from our parents or grandparents. Yeah. Now that we know what cancer is, let's talk about tubulin. So, in a quote taken directly from the National Cancer Institute, tubulin is one of a group of proteins found in high levels in the cell's cytoplasm, which is the fluid inside a cell but outside the cell's nucleus. Tubulins are one of the building blocks for microtubules, which are narrow, hollow tubes inside of a cell, which are involved in cell division and cell movement. As you can see, there's a nice picture of the polymerization and depolymerization of tubulin on more of a molecular level. Like here's the alpha and beta subunits, which we'll get to later. So the mechanism of action for tubulin and thus microtubule formation, we have dynamic instability and stability. It's driven by GTP hydrolysis. Tubulin heterodimers, alpha and beta subunits, polymerize into microtubules. They assemble head to tail to form protofilaments, which interact laterally to create the microtubule wall. Structures of the microtubules and soluble tubulin have been determined by the cryo-EM and by X-ray crystallography, respectively. A GTP molecule is bound to an alpha tubulin and is neither hydrolyzed nor exchanged, whereas either GTP or GDP can be found in the beta tubulin nucleotide binding site, defining GTP tubulin and GDP tubulin respectively. Only GTP tubulin assembles in microtubules on its own, and microtubule assembly is accompanied by GTP hydrolysis. So in this nice little diagram schematic on the right here, we can kind of see the flow from microtubules to tubulin to how tubulin is formed and all of that stuff. And as you can see, GTP and GDP play a major role in this. Alright, so now that we know what tubulin and microtubules are and how they come about, now we can talk about drugs that stop their formation. So, one drug that does this is Oncovin. And the drug name behind Oncovin is vincristine, which is the drug name, and it's over here. The molecular structure is over here. As you can see, it's very complex and very big. It's a chemotherapy medication. It treats some types of cancer by slowing down cell growth and division, like leukemia, lymphoma, and neuroblastoma. These are just some types that they work best with, that this drug works best with. It's a IV injection. So it's usually done in a sterile hospital setting and monitored by doctors and nurses. And it's important to not miss doses of this medication because of its effects. So, how Oncovin binds to tubulin. So, particularly this happens during the M and S phases of cell division. It blocks glutamic acid utilization with nucleic acid and protein synthesis. The inhibition of microtubule polymerization by binding to tubulin subunits within the lattice microtubule lattice structures, thus preventing new subunits. It binds to the plus ends of the microtubules, and therefore disrupts the formation and functionality of the mitotic spindle. Due to this, cells can continue through the cell cycle, and so they arrest or stop at the metaphase stage, but making sure that the chromosomes can't align and then thus separate before cell division. And then due to the long time that it's rested at the metaphase stage, apoptosis, aka cell death, occurs. And this drug selectively targets rapidly dividing cells, such as cancer cells, and it's important that it does this because cancer cells depend on the functional microtubules for the cell division and for transport throughout the body. So, that is how Oncovin binds to tubulin. And then we're going to briefly talk about the metabolism of this drug. It's very extensive in the liver, so you have this drug, and then these two enzymes are within the liver, and then it kind of goes into the it's broken down, and then it's eliminated in the bile of the pancreas, the feces, and the urine. It's not so much the urine, it's more the bile and the feces. So the adverse effects of Oncovin, just in general, and also if there's a misdosage somewhere in there. So as you can see, it's 1 mg per 1 ml. Yeah. So some adverse effects are nausea, vomiting, weight loss, diarrhea, dizziness, headaches, some mouth sores, hair loss, which is with any chemotherapy drug, and constipation. And I know diarrhea and constipation kind of don't go on the same list, but it affects different people differently. So, alright, here are the references. Thanks.